So Rhys Williams is the Manager of Expertise at the Australian Research Data Commons, and he leads a team of subject matter experts supporting the ARDC's collaborative projects to develop datasets, tools, platforms, and communities that enable Australian researchers to make the best possible use of their data. He's also a part of a small team delivering the HeSANDA project. Rhys has a PhD in molecular biology and a career spanning medical research, tertiary teaching, consulting, technology, commercialisation and university management. Thank you, Rhys.
Thanks, everybody. Thanks, Katie. You've got me in place of Dougie. Dougie will join us shortly. And my colleagues have introduced ARDC quite well, so I'm assuming that I don't need to tell you more about ARDC. I'm going to specifically talk about Health Data Australia, which is the product that a few people have talked about, which is the end product or the end result of part of our HeSANDA program. I'd also like to acknowledge the Gadigal people who we're meeting today. I'm from Ghana country in Adelaide. It's a pleasure to be in Sydney. I think Matthias covered some of this. The HeSANDA was it's a project that we've been working on for 3 years. The critical thing I think to say before I jump into the end point is that this is an ongoing thing, that it's very much a project that's co-designed with yourselves and other people in the health research community. And I was at a conference last week where people talked about hard infrastructure and soft infrastructure, which I kind of liked. So I'm going to jump and talk about the hard infrastructure, which is HDA, the technology stuff. But the project, HeSANDA project, doesn't just include that. It includes a lot of the other things which I would argue are actually more important and more difficult. Things like coming up with metadata standards from communities, getting the community of practice working, coming up with agreed consistent practices around how you curate data along the lines of FAIR, which Matthias talked about. Things like governance, consent, ethics, policy, consistent policy development, all those kind of things. The HeSANDA project is doing those. I'm not going to talk about those in detail, but I'm happy to, some of the questions we've been receiving go down that path, and I'm very happy to talk about those in the context of the panel, perhaps. But what I'm going to do is talk about Health Data Australia, and my very willing assistant Martina has agreed to help me in just a minute, Martina. So, just giving you a bit of a warning. We've been talking about the HeSANDA nodes. Just so you know, there are 9 nodes around the country. 7 of those are really aligned with the health translation centres, with the clinical, is it called? The research translation centres, I think they're called. And a couple of them, mental health being one that Alison's just joined us from, and the cancer node, the CCTG node that obviously ALLG auspices, are really more discipline specific or discipline aligned across the whole country. And the nodes have been working with us from the very early stage and are a critical part of making this work. So I'm going to do 2 things. I'm going to show you in diagrammatic form how HDA works. I'm jumping into the hard infrastructure now. And then I'll give you a very quick demo, or Martina will. So I've now said, the rule is never work with small children, animals, or live software demos. So I've left the animals and children at home, but we are going to do a live software demo in a minute. Here's sort of a depiction about how HDA works. Obviously, your researcher produces data outputs. They have their governance procedures in place, hopefully. And they produce metadata if they're doing the right thing, as Matthias has explained, and that's another discussion for another day as to whether people produce adequate metadata. To get it into HDA, we're using two things that one that people are used to doing. One is they're used to putting their entry into ANZ CTR. That already exists. It's a rich source of data about the trial. And the second thing that they have to do, which not everybody has been doing until now, but they do for HDA, is they create a record with a service provider called datasite, which assigns a digital object identifier to the data set. And when you register we call it minting your DOI with datasite, you're required to enter a whole lot of stuff of metadata, and that standard of metadata we agreed across the HeSANDA nodes. So it's quite a rich set of about 40 odd fields. That has to be put in, but that gives us the ability to then automatically, machine to machine, as Matthias explained, what HDA does every 24 hours is it pulls in the data from ANZ CTR and the data from, the metadata from ANZ CTR and the metadata from DataSite to create the catalogue. It's important that I mention it's not the data itself. The data itself stays well and truly in control of the individual nodes or however they've organised themselves. So it's only the metadata that goes into the catalogue. The next thing is, of course, that a secondary researcher, like Sir Alison just described, can search the catalogue, which I'll show you how we do that in a minute. They say, oh, that looks like an interesting data set I'm interested in. They can have a look at some of the information to clarify whether they want it or not. They can then fill out a search request. That search request goes off back to the primary researcher or back to the administrative unit of the primary researcher, who can then look at whether that request is in accordance with their rules, whether all the right things are in place, the ethics for the secondary study, for example. They can go back and say, can you please clarify this? There can be a bit of to and fro, but then they make a decision as to whether or not they're going to share the data. And then they make those research outputs available, particularly the participant level data. So we're assuming that actually ideally your study protocol and your other documents, sometimes it's not, but ideally they would be as open as possible. And there's a couple of examples, and I'll show you one in a minute, where people have actually put a lot of that information on the public website, on their landing page, but the IPD obviously has got to be securely accessed. So if the requirements are met, then you as the data custodian say, here's the secure platform that you can come and access that data, having ticked all the boxes. So that's how it works. And now Martina's going to show me how it really works. So the link is researchdata.edu.au/health. Can we have the live, please? Which is this one. And at the moment, in Matthias's slide, if you click search, this is the portal which I won't go into. You see that Matthias must have done a recent screen grab, because there are indeed 117 data sets. It's not 117 trials, this is 117 data sets so far. Down the left-hand side, you'll see that you can search easily by looking at either a subject area. Publisher refers to the group, so you see ALLG is one of the groups that's contributed trials. And then there are some condition codes and sort of disease areas that are specifically drawn from ANZ-CTR. So if you know the broad area, you can jump in. If you don't, well, you can, of course, go and do a search keyword. So, for example, if I want to look at, if I type in chronic myeloid, because given we're in an ALLG meeting, I better do something vaguely blood cancer. There's a list to which that term chronic myeloid comes up. If we click on one of those, we'll see the detail of that data set. And as Martina scrolls down, you'll see that the organisation that contributed, the publications and so on would appear in that link diagram in the middle. That's done on the basis of metadata. The DOI for the data itself is where that identifier is. That would take you, in this case, it would take you, can do that if you want, Martina, that will take you to the ALLG's landing page, which tells you information about the data set. Yep, there it is. And in most cases, you'll get more information there, and if there's publicly available information about that data set. If we just go back again, given that I'm doing this. Is Dougie online too, Katie? Yep, great. And then down the bottom, you see where it says related study, that's really the source study. There's information, again, drawn from ANZ-CTR, but particularly some information about the trial, but some information about the data sharing, so the data sharing statement. So this tells you, is this data available for sharing? When's it available? That can be embargoed, for example, and what sort of data is available under what sort of conditions. That's not a data sharing agreement. You need to sign one of those later, but at least it gives you some indication of whether it's going to be reasonable to put in a request for this. Just to show you perhaps one more, you can scroll down to look at particular areas. So if we clicked, I think we agreed we'd do food and nutrition, diet and nutrition, just for something different. There's a mental health category there, clearly, as some of the trials that Alison's mentioned. Where's the other one? Oh yeah, take that. We've got diet and chronic myeloid. This is a trial from SAMRI, from our South Australian node. In this case, they've got a bigger graph in the middle there, which we haven't expanded, but that's all driven by the metadata. You can have multiple funding parties, you can have multiple authors, you can have multiple publications. And again, a similar data sharing statement and conditions there. In this case, I'm only showing you this one just as an example. This takes you to the SAMRI portal. And in this case, what they've done is they've made the publicly available documents available there. So if you want to download the statistical plan, you can do it now before you look at the data. So if those things are available, that's good practice to make them openly available, and clearly the IPD is not openly available, you'd have to request it. So that's a couple of very quick examples, and I can do some more later if you want. So if you can go to where it says access the data, scroll up. So if that was the data I was interested in, if I clicked access the data, it'll expect me to log in, which I'm not going to do because it's complicated. But I'm happy to go back to my slides now, please. So this is you to pretend that I'm requesting the data set. When you click the access the data, you get this form. You have to fill out some information about why you want it, who you are, your organisation, that sort of thing. Some information about the project that you're going to use with this data. You're going to use this data for. A little bit about, again, part of this information about the project and why you're doing this, the rationale and so on, and how you and what output you expect. It may be that you are going to use this for a meta-analysis, for example. You may be going to use it for a different kind of trial. You may be merging it with something else. And then obviously, last of all, your ethics. And then down the bottom, you can either click submit or you can save this and it'll save. It's a bit like doing your forms and saving them partway through. If you get stuck, you can just save it. It goes through. And then very quickly, without showing you this, that then goes off to, and we've also built this system, this goes off to, so if it was a clinical trial for cancer, it would go to Martina. Martina would receive an email saying there's a new request. She has a dashboard that she can monitor requests. She can look at the detail of that. She can send it off to somebody in their organisation to provide advice, the chief investigator, for example, or the ethics committee or something like that. And if it's all approved, then there's a pathway which is, again, done entirely within the system that allows you to track the progress of those requests. So that's the findable and accessible part that we've tried to contribute to. I'm going to finish there, but I'm happy to take other questions. That's the address and our sort of standard generic address is HeSANDA at ARDC. But I'll just do this one as well. So if you're not involved in this already, if somebody online or somebody in the room is not already involved, you can contact HeSANDA if you want to put your trials. We'd love to have more than 117 trials, clearly. And the other people, the key contacts are the people who are administering the nodes. So those details are on there. And each node has an address that you can contact. This will expand, and I can talk about that in the panel about what our plans are for next. And these are my colleagues, just to acknowledge Kristen, Adrian and Amanda, who's our technical BA. Well, that's probably enough. Thank you.